It's Jackie over here hanging out in Korea teaching level 1 this weekend, and I just got a question about mobilizing the Tib Fib joint at the knee. Now this is actually a common question that I get because this joint over here, again Tib Fib joint, this is the proximal Tib Fib joint, there's obviously a distal one as well, oftentimes it's very stuck. So if you try to mobilize it, I'll come down here, if you try to mobilize it, oftentimes it just gets stuck. Okay, it doesn't have any movement anterior, posteriorly, or anything like that at all. And oftentimes it's also going to be very tender to the touch. Okay, this is a very common issue. And there's a couple of things that I like to do with the client to help alleviate some of this pain and also increase function as far as just tibial rotation, tib fib rotation, internally and externally. Okay. So the first thing I like to do is actually do a little bit of a nerve floss or nerve glide. The peroneal nerve goes straight down through here. So if we're flossing the nerve, we're basically just increasing the glide between the nerve and also the soft tissue around it, so like the muscles and the fascia, so on and so forth. To do this nerve glide, you'll be laying down supine, okay, and you'll have one leg up, and we're going to be looking at this hip angle over here. Okay, so we wanted to have the maximum flexion of the hip as long as they can maintain a straight knee. Okay, so we don't want to sacrifice the knee extension for a good hip flexion. And so if you can actually interlace your fingers behind your thigh to hold it, that's fine. But some people don't have that much flexibility, also fine as well. You can just take a towel or a yoga belt or something, strap it behind there so then they can still hold on to it, give us some support while they're in the active knee extension. So while they're doing this, the next step is going to be putting their foot in a supinated position. So they can invert and then plantar flex and then also rotate. So just a supinated position, easier to say it that way. And that puts this part a little bit on stretch. And so what we'll do now is we're just going to bend our knee and straighten. Bend our knee and straighten. And you can see that I'm literally bending the knee, not the hip. There's a difference, right? So this is a little bit more basic. After this, it gets pretty easy after they lose the feeling of the stretch here. What you can do is every time they bend the knee, they increase hip flexion, but when they extend the knee, the angle still of the hip remains the same. So I can bend the knee and also increase hip flexion, extend the knee, and the hip angle also stays the same. And do that a few times, just like so, and you'll start to feel it. Oh, okay, that feels pretty good. Okay. So now that's a little bit of kind of like a soft tissue mobilization, a self-soft tissue mobilization for things in that area, just to help them glide a little bit. Next thing we're going to do is an activation for it. And we're going to do this by activating the muscles that attach to the fibula, and more specifically the peroneals, okay? Because the peroneals will actually attach to the lateral portion of the fibula. So if we activate them in a closed chain position, it'll force the fibula to actually move. Okay, so first, because most people don't know what inversion is, so we practice an open chain inversion, which means the foot is not on the ground, the leg is relaxed, knees slightly bent, and they're just going to practice a strict inversion of the foot. Okay, just so that they know kind of what they're doing. Okay, because some people try to do a supination, that's not quite right. So we just want an inversion of the foot. Okay, so when we do an open chain position, it doesn't really do that much on the fibula. Okay, so what we want to do is a closed chain position, foot on the ground. We're going to think about femur maintaining its position, so it's not going to be rotating either from the hip. Okay, we're going to keep it separate from the rotation in the lower leg. And so we're going to isometrically invert the foot. And if I put my fingers on my tibia, you'll be able to see it rotate medially. Right? So you can see, actually probably you can see my entire leg, like lower leg, just rotating medially. Okay, so inversion and relax, inversion and relax, inversion and relax, inversion and relax. You can probably see that from there, I'm hoping. Okay, and so that will be some active mobilization of the joint right there through muscles, because trying to get this part up here to move by using the femur and the hip is a little bit difficult for some people. This is an alternate way that they can do it by just using from the foot and just twisting from down here with the inversion so that it actually travels and this moves as an effect. Okay? So after that, let's check to see how this tib fib joint moves on mine, because I actually had that issue. So if we go from here, it actually moves much, much better. Much better. And, ooh, it's actually pretty good. Okay. And then the thing is, if I'm palpating around here, it actually doesn't feel tender anymore, which I'm pretty happy with, because this has been tender for a while for me. Okay. So, especially after snowboarding. But this actually works pretty well. Okay, so give that a try. Let me know what you think, and have fun with that.